I am now pleased to introduce Congressman Connolly from Virginia.
Thank you, Carol. One of the big challenges of healthcare in the United States in terms of affordability and even access has to do with the many small businesses in America that no longer can provide healthcare for their employees. As recently as 10 years ago, over 60% of our small businesses in fact provided healthcare for their employees. That percentage is now down to 40%. And if we do nothing, that's going to go even lower, leaving millions of Americans working for small businesses, the engine of employment growth in America, stranded and without health care coverage. I'm pleased today to introduce Dan Sherry. Dan is a small business owner with an engraving company in suburban Chicago in Illinois. And he's going to tell his story, both about the issue of affordability for him and his 8 employees, but also the issue of access and the capriciousness of insurance companies in denying access to health care. Please give a warm welcome to Dan Sherry.
Madam Speaker, thank you very much for inviting me to participate in this historic event. As you know, healthcare reform is absolutely essential for America's small businesses. I own an engraving company in a little outside of Chicago, a second-generation family business. I've never been able to afford health care for my employees. And even for my family, after paying into the system for 20 years, we got a large order one summer. It was a hectic summer, and I missed a health insurance premium payment, the first time in 20 years. My insurance company cut me off. They said I'd have to reapply. Well, that turned my high cholesterol into a pre-existing condition, and I'm uninsurable. And if any of you are here understand what that means, after the shock wore off, I looked at my options, and I realized the only way I could protect my family from a disaster, I'm mortal, I'm going to have a health event sooner or later, would be to divorce my wife of 22 years, give her the business, and give her my house. And that's not right, not in America. That's where I was a year ago, and that's why I'm here today. So the legislation being introduced today is critical for me and small business owners across America to be able to protect our businesses, our employees, and our families from the threat of crippling health expenses. This bill will eliminate exclusions, pre-existing conditions, and other underwriting practices that make insurance unaffordable and unaccessible for us. By creating a health insurance exchange that includes the choice of a strong public health option, this bill will provide access to affordable, comprehensive coverage. Most small businesses will be exempt from any requirement to offer coverage, but the fact of the matter is we want to offer coverage. It's the right thing to do, and it's important for us to be able to be competitive with companies that do offer it. The tax incentives in this bill will help us get that good, affordable coverage. For my business to continue to grow and be competitive, it's important for me to be able to offer health care for my employees. They're like family to me, and like most small business owners, and I have a responsibility to make sure they have the health care they need. That's why I'm so proud to have the opportunity to stand here today and express my strong support for this landmark legislation and my gratitude to the Madam Speaker and to all the other members for what you've done. America's small business needs Congress to pass this legislation to make health care work for us. That's what we need now. Thank you.
Thank you, Dan, and thank you for sharing your story. You've just heard about the struggle of one small business owner to afford health insurance for his employees. Subject to outrageous premium increases and capricious decision-making by insurance companies, hardworking Americans like Dan across the country are either unable to provide such coverage because of the cost or sinking under the weight of rising premiums. In the last 10 years, premiums for small businesses in America have more than doubled, increasing by 129%. Small businesses need health care reform, and as Dan said, they need it now. The Affordable Health Care for America Act allows small businesses to participate in health insurance exchanges, giving them the benefits of large group rates, lower costs, and many more choices. It raises the thresholds on the income surcharge to $500,000 for individuals and $1 million for families, something we freshman members of Congress worked awfully hard to get in the bill, and I want to thank the Speaker for her help and assistance in making that happen. It provides tax credits to help small businesses afford to provide health insurance coverage for their employees, and as Dan said, For so many small business owners in this country, their employees are like members of their family. They want to do the right thing. They want to provide this benefit to their employees. It now gives me great pleasure to introduce one of the great leading lights in the United States Congress, a thoughtful and articulate leader, our Majority Whip, James Clyburn of South Carolina.